which I talked about was solution overview. So staffing challenges faced by healthcare agencies. We propose to implement a comprehensive solution that optimizes our staffing processes. This will enhance our ability to meet the client's demands and promptly and efficiently. So it's important that you're able to explain this in a way that is according to the particular contract as well. So you will show evidence by you've got enhanced staff scheduling system. So for example, you've implemented a robust scheduling software or system that enables real-time tracking of staff availability, skills and preferences. So there you're talking about the solutions that you can provide them with. You'll be utilizing predictive analysis to forecast staffing needs based on historical data, seasonal trends and client demands. Now I'm going to go into that because this is really an important factor as well. For example, I've created this spreadsheet which is being done as a software, for example, and this is about predictive data in a certain location, whereby you know when staff are going to go off sick, the number of staff that's roughly going to go off sick because of the location for one, and also the geographical area as well, and also this the history. There's data from years before, like the previous year and the year before and the year before, and you will see that there's a seasonal trend that's happening, and that is what's going to cause client demand for it to be high during those periods of time. You see it all the time. Christmas, people are going off sick because they're sick, for example, or a loved one or family member, for example, friend is sick, so they can't come into work. So that then impacts the company. Then you have to have agency come in, for example, to cover 4 shifts, for example. So I'm just explaining about the historical data in a certain geographical location. And this can be really anywhere around the world, but wherever it is that you are supplying and looking to supply staff, then you need to check out what the seasonal trends are, because you will see a pattern. Enable automatic notifications and alerts to quickly identify and fill open shifts, minimizing delays and maximizing staff utilization. So for example, you've got a staff member that's working, but you kind of got a feeling, or you know that possibly at this time of the year, or it could be a certain time of the day or month, for example, that staff member is going to go off sick, or they've got these appointments, for example. So then you've got cover to cover the workload, for example. So another explanation would be that you've got the staff members. You ask the staff members what is their availability, when are they available during the week, just in case if someone goes off sick, that you then got someone to cover, and then you can just quickly pull them in to go and cover that shift, and there's no impact there. So you want to also ensure that you have a good talent pool. It's so important that you do this, that you have a good talent pool here. So you want to make sure that you've got a good talent pool. So talent pool, for example, you want to establish a centralized database of qualified healthcare professionals, including nurses, carers, and allied healthcare professionals, along with their credentials, certifications, and availability. You want to ensure that you regularly update and maintain your talent pool database to ensure that its accuracy and reliability of information is correct. So you want to implement and streamline recruitment and onboarding process to swiftly onboard new staff members and expand your talent pool as needed. You want to also make sure that you've got a client relationship manager. You want to foster relationships to gain insights into their staffing needs and preferences and expectations. So, like I said, client relationship management. So you want to foster strong relationships with our clients to gain insights into their staffing needs, preferences, and expectations. You want to conduct regular checks and performances, because if you don't do this, you will not get it right, and you don't want to mess this up, because this is really important to make sure that you're getting good client relationships. And by conducting these regular check-ins and performances reviews to assess client satisfaction, and you'll be able to address any concerns or issues proactively as well. So you want to ensure that you are having relationships, keeping in contact with someone that you want to contract with. You want to also offer them flexible staffing solutions and customize staffing plans to accommodate varying clients' requirements, because it's so important to do that. So again, continuous improvement and training. So you want to provide ongoing training and professional development opportunities for staff to enhance their skills, their competencies, and also their job satisfaction. You want to encourage culture, continuous improvement and innovations within the organization, giving feedback both to staff and clients to identify areas for enhancements and optimization. It's important that you invest in technology and resources as well, so that you're able to deliver high quality care and services to our clients. You want to ensure that you are providing seamless staffing operations to meet the needs of the buyer effectively and efficiently. So this is not only an approach that's comprehensive, but it is effective, and you will be looking at addressing the immediate staffing issues, but also it will be the foundation for a long-term success and growth in your business as well. So by meeting the buyer's needs to supply care staff and win the contract requires a thorough understanding of their requirements and the ability to present a compelling proposal that addresses the needs effectively. You also have to think about a detailed approach, which is a detailed scope of work. That has to be aligned as well, because it's important that you do that as well. So always think about your scope of work that you're going to be doing as well. So hashtag scope of work if that's something that you're going to be in charge of, for example. So moving swiftly on, I've talked about the problem statement. We're now going into the solutions overview, talked about staffing challenges that they face, and now we're going to talk about the next section here, which is just go on here, client relationship, which I mentioned, and I talked about the detailed scope of work, which defines the responsibilities and duties of care staff that you're going to supply. So what staff members are you going to supply? How many? What are their qualifications? What experience do they have? Who's going to be managing that team? What qualifications do they have to show evidence that they're able to manage a team effectively, to be able to deliver the service and be able to spot when things are going wrong so that they can act quickly? So who will be responsible for that? So you want to outline the scope of service that you're going to provide, such as the patient care, the medication, for example, the companionship, or any specialized care for a particular condition. You want to specify any additional requirements that are preferable to the buyer, such as it could be culture consideration, for example, language proficiency or specialized training needs that your staff members have undertaken as well. You want to clearly articulate the expectations regarding the staff availability, scheduling, flexibility, and communication protocols. timeline and milestones. Develop a timeline outline. Make sure that you look at this and really go through the contract, the period, the staff recruitment, your onboarding, any, making sure that everything is clear, okay? That the timelines for submitting candidate profiles, conducting interview, finalizing staff assignments. You want to define that benchmark for performance evaluation, quality assurance with regular check-in and reviews to ensure alignment with the buyer's expectations. Because the buyer, when you're looking at applying for a contract, they may be a time where they say, right, I want to come and see you, or we're going to do a Zoom meeting and I want you to tell me how you're going to deliver what you just said that you can deliver, for example. So be aware of what the buyer wants and make sure that what is in the contract that you've put in is what you've actually going to do and deliver. And make sure that you've got all the systems in place that's going to show that you have done that and evidence of that you've done it. There's no point just talking about it. What is the evidence that you've got? So you want to also look at the contingency plans for addressing any staff shortages or emergencies to minimize any disruptions to the service.